Diana. My children, ages 6, 8, wow, 15 and almost 19, have been coming to the Charles Demo Group for about 10 years. My oldest two have had their ortho done here. Ironically enough, both my husband and my brother-in-law were patients of Dr. Charles and had their orthodontia done 30 years ago, maybe. Although my husband does say that Dr. Charles hasn't aged a day, and he wants to know why. But my oldest Megan has come here for 10 years. She did her orthodontia. She's done fillings and all sorts of wonderful things and has a great attitude going to the dentist. Scott, who's 15, was a little bit dental phobic. He did not have enamel that formed on his back 4 molars, and at age 3 and a half had 3 root canals and crowns done by a pediatric specialist, and he was awake for that, and it left him very much scarred. So we spent about 10 years, the past 10 years here, getting him over his dental phobia. It's gone. He has absolutely no problems coming to the dentist, and everybody has been very patient and kind with him. Jake is my lucky little guy. He's 8. He doesn't have any cavities or dental issues, and every time he comes he gets his teeth clean and a toy, and he's perfectly happy. My youngest son Will is 6, and he's autistic, and he started coming here 2 years ago, and I saw a spot on one of his molars. And we came in, and Dr. Hirsch had him sit in the chair and just kind of, you know, get familiar with the dentist. And we tried a couple appointments like that to see how tolerant he would be to touching his mouth and looking in his mouth and seeing what was going on. And we determined as a team that perhaps we'd call in the pediatric anesthesiologist, Dr. Peterson, who is also equally wonderful. And so we put Will under general anesthesia, and unlike hospitals when you go in and have your child put under anesthesia, he was just in a back room. The door is open. I could go in and ask questions and walk in and out. It was a very, you know, safe, casual atmosphere, but it helped my little bit of anxiety putting a little guy under. In that amount of time, he had, wow, 10 fillings, 1 baby root canal, a cleaning, a set of x-rays, and that was it for the first time. We come every June, it seems. Then we came again in June of 2010. Same thing, we contacted Dr. Peterson. He still wasn't quite tolerant enough to sit in the chair. Same protocol. We were here about 3 weeks ago, and things have changed for Will. He's getting less and less dental phobic, which is great. He had a small fistula on his mouth, and he had an ear infection, and he has a teeth grinder. So Dr. Hirsch explained that most likely some of the bacteria traveled up the tooth and was causing white protrusion along his gum line, but really the only way to get rid of it is to remove the tooth. So the child who had to have general anesthesia the 2 previous times, we put some numbing agent along his gum, no shock, and just removed the tooth. And you might think that would deter him, but he was quite fine with it. He cried a little bit. He got up out of the chair, picked a prize, and came back and sat down. So it was kind of nice. His experience, even though he was a little frightened at first, turned out to be a positive one, and it's been great. Come see us. Come on over, give it a shot. I have a dear friend who is very dental phobic because the dentist she saw previously, they had the habit of taking blood pressure, and oh, your blood pressure is really high. Oh, is there a problem? And it just would set her off. And she said, I am afraid to go to the dentist. And I said, well, no, they're not going to take your blood pressure. I said, just relax. I said, the worst thing they're going to do is give you some x-rays and a cleaning. They've never have pushed you to do anything. We've had some cases of fillings that, hey, we're letting you know we may need to do a root canal on this. We may not need to do a root canal. We're making you aware of what's going to happen. There's no reason to be dental phobic. It's very nice, calm, relaxed office. especially if you're a kid. You might find a Pokemon movie that you've never seen, and all of a sudden the child isn't even aware that they're having their teeth cleaned. Oh, my kids have really nice looking teeth. If Dr. Charles showed you the pictures of my husband Bob, and then showed you side by side those lovely panoramic images they do of the teeth where they put the wires in the mouth and they spread your gums back. My daughter's teeth actually look identical to her father's. They've had similar procedures with bionators and retainers, and I will tell you, both my husband and my daughter have beautifully straight teeth. Scott's are coming along. He just got the braces put on about 5 months ago. His course of treatment, he was a little slower because he was a little lackadaisical about turning the key on the retainer. So now we've got him on board though. He's got his power chains. He's coming in on Thursday and having a checkup, and especially for the kid who was completely dental phobic, to actually look forward to going to the dentist was a huge improvement for our family. Extremely easy, actually. If you're me, I schedule them 6 months out for my cleanings. If you're my husband, as Rika knows, he's a little harder to get a hold of because he's in and out of town. Very easy. 10 years. Primarily, you know what, it is a family-run business and I am not related, believe it or not. When you come in here, when you call, they know who you are. Everybody's always very kind, very polite. They're realistic. Things come up in your schedule. Oh, no problem. We'll take care of that for you. The patience is critical, especially if you have a child with special needs or any child who has any kind of anxiety with going to the dentist. You need somebody who's going to say, you know what, we're not going to push. We want this to be a positive experience. And I still remember Dr. Moser, when Scott was 5, hey, if he only comes and sits in the chair and opens his mouth and I look, I'm happy. We don't want him to be afraid to come or to be afraid the mouth hurts or to cry. Who wants to show up and have a child crying at the dentist because they're afraid? And so everybody is very patient, everybody is very kind. It just makes dental work in general a very positive experience. Like a family. They're not going to squabble with you like a family would. They're going to be the ideal family that are kind and courteous and professional and thoughtful and willing to work with you. Yeah, I wouldn't go anywhere else.